My name is Leanne Brady. I am a researcher based in Cape Town, doing work on everyday resilience. So what is everyday resilience? The Ebola crisis really put the importance of resilience back on the global health agenda, but our work argues that it's not only these large shocks like Ebola or a flood or economic crisis that are important, but it's the everyday routine challenges that frontline staff face on a regular basis that are also important to take into account. This work comes out of long-term collaborations with health managers in a number of different sites in South Africa and Kenya. We call these learning sites, and they are collaborations between researchers and other health system actors, frontline workers, health managers. The goal is to understand these stresses, these chronic, everyday, routine stresses through the eyes of frontline managers, to document them, to understand the sheer number of chronic stresses that people on the front line face. And it's things like multiple meetings, staff absenteeism, drug shortages that are chronic, violence in the South African setting. We're working in Mitchell's Plain, which is, some parts of that are particularly violent. So these multiple routine challenges have impact on the everyday lives of people working in the health system. So we're documenting what these are to understand their impact, and we're also trying to understand the ways in which frontline providers are responding to these challenges. So what we know is that everyday resilience requires new forms of leadership, and we need to support health managers very differently from how they are ordinarily supported. These new kind of leadership practices are really about distributed power, decision-making power across the system. So it's not the hierarchies that we usually see in health systems where one person makes decisions. Instead, it's teams working together to collectively understand and find creative solutions to the things that they face. So this kind of leadership requires very different approaches, and this is a very significant this has very significant policy implications. This kind of research in some ways is different from other research in that the researchers are embedded in the health system. And so part of the work we're doing is also to understand if the presence of a research team in the health system can also contribute towards that system's resilience. It's about long-term relationships between researchers and people working at the front line, and recognizing that that relationship itself is very important. So it's not drop in and drop out and take your data. It's very much about working together, walking together really. And the ultimate goal is not to produce papers. The ultimate goal is to support the health system in the ways that it needs and support people in the health system in the ways that they need.